Welcome, everybody. Thanks for joining us today. My name is Spencer Kent. I'm a reporter for NJ.com. And with us today is Rutgers University scientist, Dr. Donald Schaffner. He's a microbial risk researcher with focuses in hand washing and cross-contamination, and served on the World Health Organization expert committees. How's it going, Doctor?
Hey, Spencer. It's a pleasure to be here today.
Absolutely. So with the state continuing to reopen, we're going to go over some things that are no doubt on people's minds, my mind, things we should know, how we can stay safe. So let's jump right in. So, Doctor, how long does it take for someone to become infectious after they've been exposed to the virus? Like if you go to bar A, for example, and encounter someone infected, and then go to bar B, what's the time frame before you can be exposed?
That's a good question. We know that most people, or the median on average, basically is 4 days. And so once you're exposed, it'll take 4 days until you start to show symptoms. We also know that some people, it may take as many as 14 days before they start to show symptoms. We're not really sure what the short end of that is, but I would estimate it's probably something like 24 hours. And so it's not like you're going to inhale the virus in one bar and then exhale the virus and make somebody sick in the next bar.
Right.
And so that risk is really pretty small. But it's much more likely if you go out the next day, you may be shedding the virus and not even know that you're sick. So that's really more where the risk comes from.
Right. And do you think we should still stay away from, restaurants and bars, other indoor places, even after lockdown is lifted?
Well, I think everybody needs to think about this and make their own individual decision, right? So the calculations that I'm going to make as a almost 50-something or almost 60-something guy might be different than the calculations that you're going to make. I'm more likely to get more seriously sick. I think if somebody was immunocompromised, if they're diabetic, if they're asthmatic, any of these risk factors, that's going to change the calculation about whether you want to go out and you want to put yourself at risk. And so everybody, I think, is going to need to be alert and make their own best risk decision.
Right. And with that, going forward, at some point, are we all just going to have to accept some, level of risk? And if so, how much?
Yeah, that's a really good question. I think it's important to frame this risk discussion generally and realize that we all accept risks every day. We did before the pandemic and we will after the pandemic, right? There's a risk from driving a car. So we wear a seatbelt, we obey the speed limit, right? We do things that we know make us safer. And I think the same thing applies to COVID-19, right? People are going to have to, I think, maintaining social distancing is a good idea. Wearing face masks is a good idea. Washing your hands, using hand sanitizer, all of these things are really good ideas. And we need to keep all of those tools available as we continue to watch the situation and manage the risk.
And how long do you think that kind of stuff is going to have to go on? Wearing masks, social distancing, other measures like that. How long do you think?
Yeah, it's really hard to say. I mean, I do want to say we've done a fantastic job of flattening the curve in New Jersey. For the most part, the cases continue to go down and down and down, and that's really good news. I would hate to see us reopen and sort of go overboard and have to see those cases start to climb up again. If we do see that, we may have to go back to more shutdown type activities. I mean, again, New Jersey's been doing a great job. Florida, not so much. They're actually up now, I think, more cases per day than before when they started to flatten the curve. And so I would hate for us to find ourselves in a situation like that and undo all the good work that we've done really flattening the curve.
Yeah. And then, indoor gatherings. I know a lot of friends have talked to me about that. What do you foresee when it comes to small indoor gatherings going forward? Good idea, bad idea?
Well, I think, again, I'll come back to the idea that everybody needs to make their own individual decision. But in doing that, again, you want to think about, are you somebody who's at risk? And then I would ask the question, like, how small is the small gathering? Is it maybe another couple that's also been sheltering in place, and my wife and I are going to go over to their house and we've been sheltering in place, and we know that neither of us has been exposed to the virus and we've all been symptom free for 14 days? Well, that's probably a reasonable reduction or reasonable risk measure to take. Now, if it's a slightly larger party with 10 other families, and I don't know some of the families, and I don't know, maybe some of them are visiting from out of state, and we don't know, what the level of risk is. is. Maybe they've been traveling. And so those are all the kinds of things that need to go into that calculation. And then also what are going to be the rules of the gathering? Are we all going to wear face masks? Are we going to bring our own food and our own beverages? Are we going to share? All of those kind of things would go into the calculation about whether something is probably a good idea or not.
Yeah, I guess you're saying like constant vigilance, paying attention. Do you see, just staying on that for a second, do you see, not having this uniform idea, this simple, linear plan? Do you see any problems with that?
Well, I like the idea that we're gradually reopening things. And I think what I'm preparing myself for and what I think other people should prepare themselves for is it may be 2 steps forward, 1 step back, right? We may have reopening, but if we see the cases start to spike, then we're going to need to shut things down again and maybe close some things. And so, and I think we just all need to be patient and realize that we're going to get through this, but we really need to take it cautiously and again, not undo all of the good work that we've already done flattening the curve.
And then what about the fall? The threat, the virus coming back in the fall. Is there any measures that we saw in March? Everybody stocking up in toilet paper, everybody stocking up on paper towels. Is there any measures that the public should take now, like stocking up on items just in case of another surge? Yeah,
that's a really good question. And so I would say stock up, but have a plan for how you're going to stock up, right? Like don't overbuy food and then have that food spoil or go bad, right? Buy things that are less perishable, and then practice get a stock rotation for your own pantry and your own kitchen, right? What really is terrible is if some people stock up and they hoard things, those things are not available for other people, right? Like we were all pooping the same amount, and so we didn't all need extra toilet paper, but because of that, then people didn't have toilet paper, right? And so I think we need to sort of be sensible about that. Yeah, maybe buy some extra toilet paper, but you don't need to fill an entire room of your house with toilet paper. Get an extra bottle of hand sanitizer, but you don't need 10 bottles of hand sanitizer. Buy some extra food, but again, you don't want to build an annex to your kitchen to take care of all that extra food because eventually it's just going to spoil. And now if it spoils, then that food's not available for somebody else who maybe really needed it.
Yeah. People love stocking up on the items. And this one interests me. When it comes to notifying the public, there's concerns about privacy and or just how much technology should be involved. But when it comes to notifying the public, what do you think about like a public alert system on people's cell phones to keep them informed, the sudden resurgence? Do you think New Jersey could benefit from something like that?
Well, as a techie guy, like I like the idea of technology that I can have on my phone that will help me with things like this. But at the same time, I think it needs to be appropriate. Like, so let's play out a scenario here where this wouldn't go so well. Let's say I get an alert that says that, hey, there's an ongoing number of cases in my town or my neighborhood, and the cases are spiking, and so I'm going to leave town. Well, if a whole bunch of people do that and those people have already been exposed, the act of leaving town is actually going to spread the virus further. And so I would caution people to think carefully about those kinds of things. Certainly make a decision based on risk, but here's been the challenge with all of this pandemic response is there are certain things that we want people to do. We want them to react, but we don't want them to underreact and we don't want them to overreact. And I just worry that if a technology isn't really thought through, it may promote an overreaction, which would actually be worse than the right reaction or even an underreaction.
Right. And then how are most coronavirus patients exposed?
Right. Well, we're still so we're continuing to learn a lot about this. We know that many people are exposed from being around a symptomatic individual. Someone is coughing, someone is sneezing, someone who's obviously infected with the virus. They've got an elevated temperature. And so we know that certain people are exposed in those situations. We also know that there are people that have been exposed through either asymptomatic individuals, people without symptoms, or people that are pre-symptomatic. In other words, they don't have symptoms right now today, but in a few days they're going to have symptoms. And we know that there have been a number of people that have been exposed in those pre-symptomatic situations. We also know that there is a small risk posed by what public health people call fomites. These are really just inanimate objects. And there are at least 2 examples in the published literature, 7 million cases more plus around the world, only 2 cases where it's been transmitted that we've documented via inanimate objects. And so there also is a risk there, although we think it's low, we don't know exactly how low. And that's why we still want to practice good hand washing, using hand sanitizers, avoid touching your face and your mouth, especially after you've been out in public, and so those kind of things are still good risk mitigation measures. Although remember, the primary risk is from either people that have the symptoms or people that are going to get the symptoms.
Gotcha. And this one's caused a lot of debate. What do you foresee happening if there's a localized outbreak at a school? How much risk is there to others in the community?
Yeah, well, again, there's definitely a risk, and we used to think that kids didn't really get it or didn't get very serious symptoms. We now know that at least in some children, there can be a kind of a dangerous skin condition, like where they get a skin reaction. And then also in terms of kids, those kids, may not be very sick, but they're going to go home and they're going to expose their parents. Many families have elderly grandparents. And again, the older you get, the higher at risk you are. The kids may have parents who are diabetic or asthmatic. And so that will put the parents at risk. And so there is definitely a risk from kids being exposed at school. But again, we need to have a plan for how we're going to manage that risk. And again, I would just say little by little, we'll get through this, but it's really important to have a plan.
And I feel like I can guess your response on this next one, but your opinion on a vaccine by the end of the year, do you think that's realistic?
It's really hard to say. I mean, if we did get a vaccine by the end of the year, it would be unprecedented in the history of the planet. That said, there's a bunch of really smart scientists in a bunch of different labs all over the world looking for a vaccine. The problem is we have to go through clinical trials. We want a vaccine that has at least 2 characteristics. Number one, it has to actually work and protect you from the virus. And number 2, it has to not have any adverse consequences or minimal adverse consequences. We don't want the cure to be worse than the disease. And of course, so we have to proceed carefully with the appropriate level of science, the appropriate level of rigor to make sure that we have a vaccine that will work and that won't make things worse.
Gotcha. And then what do you think the risks, what do you think are the risks involved in returning to normal activities at a building when, the building itself hasn't been used in the last few months, say?
Yeah, well, again, I would say that the situation that we're in now, returning to buildings that have not been in active use or high use for a long time, again, this is an unprecedented situation. We've never had a situation like this in the past. And we do know that there are potential public health consequences. For example, there's a disease caused by a bacterium called Legionella, Legionnaire's disease or legionellosis. And this is caused by stagnant water. And so there's a possibility if you reopen a building and you start running that plumbing, that there may be Legionella bacteria in those pipes. And then by opening that plumbing, you're going to create aerosols and droplets of water that people will breathe in, and they might contract Legionnaire's disease. And so we have to work very carefully with building and facility engineers to make sure that we don't have those kind of consequences when we reopen these buildings. But they are, again, there's smart people working on this, but it is a risk that people need to be aware of.
And this one has caused some controversy lately. Late last month, that medical doctor from in Milan, he said that the coronavirus, quote, no longer exists clinically. Many experts rebuked him for causing confusion. Comments like this, how do we view them? How do we view claims like these?
Well, there's a lot of people out there saying a lot of things. What I would encourage people to do is not just cherry pick individual stories, but to look for scientific consensus, right? What are reputable scientists from fields that public health that know about this stuff? What is the CDC saying? What is the World Health Organization saying? What are reputable scientists that are associated with universities saying, right? These are all trusted experts. And then I would look for consensus among those experts. And again, this is a novel situation. There's a lot that we don't know. Different experts may agree to disagree, but again, in most cases, there is a pretty significant consensus that about what is actually happening with the virus. So I would say don't trust just one person or one source of information. Consider a broad array of sources when you're making your decisions or you're assessing what you think is right or correct or true.
Gotcha. And what do we know about the effects on people who have survived COVID?
Well, there are some people that apparently emerge completely healthy. There are other people that do seem to have a lingering case of the virus, and they've gone on for much longer than for other people. And then there may be people that have lifelong debilitating consequences. And this is true for all diseases, and it's probably true for COVID-19 as well. And again, remember, still we are in early days. And so I think as we get further and further distance from this pandemic, especially from places that got hit first, like China, we look for the scientific reports coming out of China about those long-term consequences. That'll give us a better picture. And there may also be differences in different countries because of the different medical interventions that were tried and things like that. And so, again, I think the picture is not completely clear. Certainly, it's a serious disease. Certainly, there may be potential long-term consequences, but we don't really know the full picture yet, and it will become more clear in the coming weeks and months.
And then what will remain unique to the New Jersey, New York region with regard to the pandemic and its initial aftermath?
Yeah, well, I think we in the New York and New Jersey region need to be especially vigilant, right? We are a highly populated part of the country, and you saw that happened, right? In the county where I live in New Jersey, high population density, high number of cases. We saw that in New York City. We'll see that throughout both regions, right? And so that because of that high population density, that does pose us at increased risk. Again, we've done a fantastic job of flattening the curve, but it means that it's probably more likely, or it's potentially more likely, that if we relax, that we'll start to see those cases spike up again. And so I think, again, huge shout out to everybody who did it, right? We did it. We flattened the curve, but let's be careful and let's cautiously reopen and make sure that we don't start to see those cases climb again. Because of our unique population density, we are I think at greater risk than places that are less populous. But again, we've shown that we can do it before. I'm sure if cases start to go up again, we can handle it again.
Yeah. And since researchers have found traces of SARS-CoV-2 in the wastewater in various parts of the world, is there a risk? Is there a risk that's entered irrigation systems and created risks within fruits and vegetables?
Sure. Well, there's a couple of parts to this answer, right? So the first thing is just because, and there's two different ways you can look for the virus. So just because you found viral RNA in wastewater, for example, doesn't mean that there's actually infectious virus particles there.
Right.
And if you found low levels of viral RNA, it's pretty unlikely that you found infectious virus particles. So that's one aspect to consider. And then the other aspect, I mean, we are very concerned about the quality and the safety of the water that we use for irrigation. But I would say, as a food safety expert, we're much more worried about things like pathogenic E. coli and salmonella than we are SARS-CoV-2.
Right.
Again, as far as we know, 7 million cases around the world, 7 million plus, no cases linked to food or to food contact, food packaging material. And so even if the virus were to get on food in the field, I think that risk is much smaller. Obviously, we want to have high quality irrigation water. And again, we're working with the FDA and with other scientists to do research to know exactly how to do that. So, but on the list of things that I lie awake at night worrying about, I'm not really worried about SARS-CoV-2 in the water being used to irrigate my fruits and vegetables.
Good. That's one positive. And then lastly, are there special measures being taken to clean solid hospital waste before they're dumped or buried in the ground, especially near agricultural lands?
Yeah, well, again, remember, no link to food as far as we know. And the other thing I'll say too, I mean, this virus is devastating, right? This virus is wreaking havoc. But the good news is, from the point of view of all the possible viruses in the world, this is not an especially robust virus. It's just as wimpy as other similar coronaviruses. And so we know that it's relatively easy to inactivate. You can inactivate it with heat, you can inactivate it with disinfectants. And so I'm not especially worried about hospital waste. And again, remember, we have rules in place to manage all the other nasty stuff that comes out of hospitals. And so the SARS-CoV-2 is not any more resistant to any of the other stuff that's already in that medical waste that we already need to be managing by the systems we have in place. So again, not one of those things that I'm spending a lot of time worrying about. I'm much more worried about getting the virus from another person, because we're standing too close, or they cough on me, or what have you. Those are the things really that I worry about much more so than, let's say, I mean, of course we need to properly handle hospital waste, but that's not a thing that I'm worried about with respect to SARS-CoV-2.
Gotcha. All right, that's it. Just a quick catch up. I really appreciate it. Thanks so much for taking the time. It's a strange time. We're all trying to figure this out, and you definitely helped answer some questions. So really appreciate it. And of course, be sure to follow NJ.com for more information. And take care, everyone. Thanks a lot.
Thank you, Spencer. It's a pleasure.